Hello, everyone. My name is Idili from therapyforme.co.uk, and today I'm here with Joni Latham, CBT therapist and trainee clinical psychologist, to talk about parenting, compassionate parenting, and communicating effectively with teenagers. Hello, Joni. Nice to see you.
Hello, great to see you again.
It's really nice to have you here. And I think we are going to cover a really interesting topic today that is discussed quite a lot, not just in the therapy room, but you hear that a lot, communication with teenagers and the challenges that it entails.
Yeah, I think this is a really hot topic because it's so hard, and there's so many people trying their best and feeling like they're failing, and often people aren't failing, but there's always areas that maybe people could stop and think and revise what they're doing, or even just check in: am I doing the best thing at this moment in this
Mhm.
time of kind of chaos and stress as it is right now in COVID?
Absolutely. Absolutely. So I'm really glad that we have you here today to share your expertise with us. Before we start talking about the topic that we chose to focus on today, would you like to share a little bit about your background and your clinical experience so far?
Yeah, absolutely. Um, so uh, I was part of a team that set up a children's psychology service in Oxford, and that developed into a family support service. So really, we supported anyone who was struggling. A lot of the time, the people that we were working with were families with adopted children or fostered children,
Hmm.
and that adds a whole extra dimension of real challenges. But there can be so many successes, and that was what we were about. Um, I originally trained in Oxford as well, with you, Adili, as well, in the Oxford Therapy Centre, Cognitive Therapy Centre. And since then, I've gone on to manage a CAMS service, a children and adolescent mental health team in Yorkshire. And now I'm currently training as a clinical psychologist in Liverpool.
Great. Wow. So, in terms of the challenges that parents face when communicating with teenage children, what do you think that is that makes this developmental phase so challenging for the whole family?
Well, I think parenting comes down to essentially communication. How do you speak and communicate with your child so your child understands it, really takes it in, digests it? They update their behavior as a result, and also they communicate back to you that they've understood. And I think sometimes we just get lost in a messy communication.
Mm,
Um, and actually, one thing that I've learned over many years is that communication is actually really complex, really complex. Um, it's going to sound strange, but actually, um, we really understand how complex communication is when someone has an illness that prevents them being able to communicate clearly. So, if someone has a stroke, someone who's um, brain for some reason has gone through a change, we notice that it prevents them being able to communicate clearly. Sometimes in
mhm,
their mind, they think I am communicating clearly, but actually what's coming out of their words is totally incomprehensible. Sometimes what's coming out is totally clear, but they're not understanding what's being said. So communication isn't making sense. um,
mm,
if you think about communication, just to break it down further, you've inside a child's brain, they need to be able to hear what you're saying, remember it, understand it,
mhm,
find the words to respond, put a sentence together, tell their muscles how to move, which is an automatic process in the brain, and then say the words. If you think about it like that, even just putting a sentence together is really complex. And you've got a child's brain that is growing and shifting and changing. And I think sometimes we assume that the child's brain is just like the adult's brain, and they should understand this. They should be able to hear what I'm saying, and they should be able to do what I'm saying. And actually, I think I've found that most children actually really do want to do what you say. If they don't, it's possibly that they're trying to tell you something, and we need to work out what that is. But it's
Hmm.
all very, very complicated, and I think that's why we um, we need to stop, take a step back. If you notice that your child isn't getting what you're saying, or even if your partner isn't getting what you're saying,
Yes, absolutely.
because it's not just children, really. This we face blockages throughout the whole of our life. If we get stuck, we need to stop and we need to think, is there a different way to do this? Um, I think the challenge comes when actually our heads are so chock a block, with this illness that's around at the moment, that means that we're locked indoors. Um, Actually, your brain is just full, just thinking through possibilities. That actually, do you have the energy to stop and just think and retranslate what you're saying? Sometimes, no, it feels too hard. So I think sometimes, if we really want to get communication right, if we really want to communicate with our teenagers who are growing with their changing brain, we need to remind ourselves that they're not adults yet. We need to
Mm.
stop, pause, and reflect a little bit.
Okay, okay. So it sounds like communication is very complex because, as you said, it has different stages, different tasks that need to be completed effectively so that we communicate in a helpful way. And
Yeah,
if something goes wrong in one of these stages, then it means that the communication might not be as helpful in the end, isn't it? Which is
that's
really,
absolutely right.
if we break it down in this way, it's really interesting, and we can see, where complications might happen.
You're absolutely right there, Adili. That's exactly how I see it. So,
Mm.
um, if if someone is, sometimes I just simply stop someone and say, "Could you just tell me maybe what I've said in a kind of confused way, just to check that they've heard it and that they can remember it, understand it, and say it back."
Yeah,
That's
absolutely.
that's the first bit. Then
Yeah,
the extra bit is really translating whether they've understood that what you've said was asking them to was an action statement. So, because sometimes they think it's an information statement, where you say, "Could you go upstairs and get your stuff?" Yeah, I could get my stuff, and it comes across a bit cheeky, but actually, I think that's the understanding bit, that bit that we've kind of missed out on. So
sure.
really stopping at that point and thinking,
Mm.
I could interpret this as cheekiness, or I could see this as a misunderstanding in
Understand.
communication.
Absolutely. And it sounds like parents have sometimes high expectations from what you've mentioned before. It sounds like sometimes we expect children to think in a similar way as adults, although it sounds like their brains are not fully developed yet, so they don't have the same function, their brains, I mean, compared to an adult brain. So sometimes it sounds like adjusting these expectations might also be helpful.
Yeah, absolutely. I mean, usually when I'm talking to parents, I'm often talking to them about how stressed out they will get if they continue to expect a lot from their children.
Mm.
And I'm not saying we shouldn't expect that our children should understand us if we've communicated something clearly and we've really thought about how to communicate it. But if we have really high expectations and we're communicating in an adult way to
Mm.
children whose brains are not developed in the same way, I'm going to get frustrated. You're going to
Absolutely, yeah.
you're going to get frustrated, and then we all get in a mess. I get angry, they get angry. They're not
Yeah,
sure why they're angry. I'm not sure why I'm angry. So you
yeah,
get a bit stuck.
absolutely, absolutely. So, in your experience, what are the most common unhelpful patterns or mistakes that parents might make when dealing with their teenage children?
I think it's probably best to say that when I'm meeting with people, um, generally, I would say that most parents are well intentioned. They have the best intentions for their children.
Mm,
They want to be a great parent. And I'm pretty sure most parents don't want to make mistakes. In fact, I'm not sure I've met anyone who wants to do it wrong in the
yeah.
wrong way. Um, but like anyone, when you're feeling a bit overwhelmed or you've got someone crying or screaming in front of you,
Mm,
it's very hard to pick the perfect way to
pattern,
do
yeah, or
things,
more effective way of
the
communicating.
more effective way. So I guess that's the first thing to ask is am I doing um, the most effective thing in this situation? And sometimes the most effective thing is to press pause on the conversation and to walk
Okay.
away. And I think sometimes people feel like they're giving up that
Mm,
with their child, and I think that comes from the misunderstanding that we're in a battle with our children,
yeah.
which I'm not sure we are actually. I think we're all on the same side. We're in the same army, in the same side,
Mm.
and there isn't really a battle. It's just a case of trying to get a kind of clear communication, a clear understanding.
So in which situations do you feel it's appropriate to pause or walk away rather than get involved in an unhelpful conversation?
Well, I might answer the reverse in that the situations where you have to get involved is when the
Mm,
child is not in a safe situation. So you might be on the
sure.
side of a road or in a shop, and your child has misunderstood something. They've suddenly been scared. You're telling them to sit down, and they're getting out of their pram, or you're walking with your teenager, and they've got their head down on their phone,
Mm,
and you can see that they're walking into a lamppost. You don't want to walk away at that point to
of
avoid an
course. Yeah.
argument because you've got to keep them safe. But on the whole, actually, there are more opportunities to walk away than not. I think sometimes, usually, it's pride that drags us into confrontation. So perhaps pause, and your first thought maybe should be, "Is this time right now?"
Mm,
And if
absolutely.
if if you need to keep them safe, time's now. But if you don't, it's possible you could take a break.
Yeah, and I hear a lot of the time adults wanting to have the last word in a conversation, and that
Yeah.
makes it really hard for them to walk away and postpone maybe a conversation for later, or choose a better time to talk with their teenage children. But you're saying that this can be really unhelpful and it can lead to difficult outcomes.
Yeah, I mean, the main aim of parenting a child who's going to be, um, to steal Theresa May's phrase, strong and stable. Um, you would want your child to not be responding instantly. If they're in a work situation in the future and they're faced with a challenge, I'm not sure my child. I want my child to be the person who quickly responds. So
Mm,
actually, teaching them to pause is really great and really mindful. Um, I think this slightly leads on to another um, challenge. You could call it a mistake, but I think it's really hard to sometimes notice in the moment. Um, is when you read behavior from your child that perhaps isn't there.
ok-
What I mean from that by that, Adili, is if you've got a child who's screaming, it may be that and let's say you've just taken their phone off them and they're screaming at you. So we're not talking like a little child here. We're talking like someone who looks physically like an adult. So sometimes we confuse that and we think they are an adult. That's a little bit something that we need to keep reminding ourselves.
yeah.
Um, but if we've got this young person in front of us and um, they're shouting at you, sometimes we can misread the shouting as maybe anger or upset or stress. And it might be all of those things. But actually, as adults, we're more likely to feel those things than teenagers. Um, Usually, with teenagers, the same as children, they're trying really, really hard to communicate something to you. But again, there's that they're not sure what to say. They haven't got the words.
Mm.
The functioning is not going as quickly as it might do when you're an adult. So actually, remembering to that the chances are that they're not feeling adult emotions in the way that we understand them as adults.
Mm-hmm.
And usually I kind of uh, try to avoid labeling any children I'm working with as stressed, um, because usually I don't think that's true. You know, the other thing, Adili, that I've noticed as well, I think in myself, I do this with adults and I do this with children I work with as well, is if I'm feeling stressed, I seem to notice stress in other people more often.
I see. You're more sensitive to stress, not just inside of you, but around you as well.
Yes. And I'm not sure always that I'm correct. You know, if I'm in a if I am if I'm at work and I'm a bit irritable, and someone says, "Why were you irritable?" And I said, I'm going to make this person up, but I said, "Oh, Sarah, she was snapping at me all morning." And that same person says, "Sarah's in a really good mood. I don't know what you mean." And I realized, you know what? I'm stressed. And so I've kind of got my stress glasses on. They're kind of not rose tinted, they're stress colors. And they're seeing stress everywhere. We can do that with our children and our teenagers too. If you're really stressed out, the chances are you will see stress too in them. And then the problem is we start treating them as stressed individuals or angry individuals. We label them with that feeling that actually we've got. So
Mm.
we need to stop, press pause, maybe just work out what are they trying to communicate? Are they really feeling the things that I'm thinking they're feeling? Or is that something
Mm.
to do with me?
I see. It sounds really helpful to just stop and first of all reflect on our own feelings as parents, isn't it? Maybe that can be the first step to think, how is this situation, how is this behavior affecting me?
Mm,
um, and label our own feelings first and then think, am I projecting that on my own child? What are they
mm,
trying to communicate? And I guess if we feel an intense feeling ourselves, it might be a good situation to just pause and leave the conversation and come back to it later, because we might not be able to control how effective we are in our communication if we have really intense feelings ourselves that are
yeah,
difficult.
yeah,
That's
absolutely.
a good tip. That's a really
Mm.
helpful piece of advice there.
I think that, do you know, as we're talking, it's just so important that we remind everyone who's listening to this that being a parent is really hard. And I know that most people who see me think they're getting it wrong and that
I see.
they're the only one who's getting it wrong. And actually we're all trying really hard to get things right. And yes, the chances are we won't get it perfectly, but certainly if we're stopping to think before we respond, and like you said perfectly, labeling our own emotions so we know what we're feeling, um,
Mm.
you you're doing your best. So it's really important that in this moment right now, if you're watching this, that you take a break, and also you give yourself a break. You know, if someone says to me, "I think I'm doing it wrong," I don't go straight in and go, "Well, let's have a look." I usually say to people, "Well, the chances are you are doing it wrong. Do you give yourself a hard time about that?"
Mhm.
Because if you can accept that maybe you're getting things wrong, but you're not giving yourself a hard time, you'll feel a lot lighter. Whereas if
Absolutely.
if you blame yourself, it'll feel a lot worse and a lot harder. And parenting is hard as it is.
Mm. It sounds very normal to make these type of mistakes, isn't it? Everyone does that. So if we are a little bit kinder towards ourselves when we do make mistakes, it will be much more helpful compared to criticizing ourselves and blaming ourselves for not being as good parents as we would like to, isn't it?
Oh, absolutely. You get stuck in a trap. I don't know about you, Adili, but even just a few days ago, starting with a conversation where I didn't communicate very clearly,
Mm-hmm.
and um, I didn't really understand the messages that were coming to me. I came away feeling, it's my job to talk about communication, and I didn't even get that right. And
Okay.
so then I gave myself a bit of a hard time, and I found myself not wanting to get out of bed and feeling a bit rubbish in the morning. And, sometimes that affects you for days on end. The main thing to remember is when you catch yourself having those first thoughts, those unhelpful thoughts that tell you that you're a bit rubbish and that no one else is going through this and that you're the only one.
Mm,
Actually, that's when you need to have that little kind of helpful parrot on your shoulder and
absolutely.
that says, actually, I'm pretty sure, actually, you're doing your best, and I'm sure your kids will turn out fine. And actually,
Mhm,
is there anyone you can talk to about this? Because, you're probably doing all right. That's
absolutely.
the kind of message that you need to have constantly going on. So it balances against those negative ones as well.
Mm. That's a really good point. And something else that I took away from what you mentioned in terms of the challenges is that sometimes how we interpret our behavior plays a big role in whether we choose to behave in a certain way or not. For instance, what you said about walking away from a conversation. When I talk to people that they are in therapy, a lot of the time they feel that if they walk away, they might make their child feel ignored or abandoned or
Mm,
not understood, not listened to. But
mm,
actually, you made a really good point that by walking away, we might be giving our children a very important message that you don't need to have a conversation in the here and now if you don't feel ready or if it's not going to be helpful. You might as well pause, remove yourself from the situation, and come back to it later. So that's a really good skill that we're teaching them. I find that sometimes we might misinterpret um, the consequence of our own behaviors, and that's why we choose the unhelpful behavior instead.
yeah. Absolutely. Some people have said to me, I wouldn't walk away because then they might think I'm avoiding the subject or I'm going to let them off. Um, and I think before we walk away, we need to communicate a really clear, simple message to them and us. And that message is usually, I haven't understood what you're saying to me. And right
Mm,
now, I'm not sure I can understand that. So I'm going to walk away right now. But later, when I'm able to understand or you're able to say it differently, we can have another conversation. So
sure.
that's not about avoidance. That's about, again, communicating clearly and also being able to teach them that pressing pause and saying, I'm going to give myself a break is totally okay.
Absolutely. Yeah, absolutely. And do you feel that it's helpful to also share how we feel if we have already identified our own feeling? Is it
Yeah.
helpful to say to our children, I feel very angry right now, and that's why it's not helpful to continue this conversation?
Yeah, well, that's a really good question. This is a really common question, Adili. And um, I think it's always helpful to describe what you're feeling to a child because when they're learning how when things come up in them, they're able to say, "Oh, I remember my mum taught me that this was what feeling annoyed felt like." Um, the important thing with that, though, is when you describe, you need to make sure that you describe your owning your own feeling and not projecting that feeling. And I'll give you an example of what I mean.
Mhm.
So if someone is shouting at me in the street and I need to firstly pause I need to communicate what's just happened and what's going on for me. Maybe I'm a bit confused and annoyed, and then I'm going to plan to walk away until we can come back to this and talk about it clearly. Um, I would probably say, I think I might have got this wrong. You look like you're really upset. I don't know that for sure, but that's what I think I can see. What I'm feeling right now is a bit annoyed, and I
Mm,
don't know why. I think it's because I don't understand why you're shouting. So I'm going to go inside, and when you feel like you can say this in a different way, come and find me. Or
mhm.
if I feel less annoyed and maybe I can come back to see you, I will come back to you. The other way of saying it, the unhelpful way of saying it might be, you've just made me feel really annoyed right now.
Absolutely. That's so common, isn't it?
It's so common, but do you know what? Yes, I've said it. I've
Yeah,
said
we
it.
all do. We all
We've
do.
said it. Yeah.
But it's good to be aware that it's unhelpful because a lot of the time we find it as a normal part of the communication and we don't reflect back and think, is that the best way of expressing myself? We don't
Yeah.
often challenge ourselves in this way. So it's worth, even if we do actually say something like that, it's worth knowing that it's unhelpful. So it's something that we can go back and try to change next time we talk to our children. It's a really
You
good
could
point.
you can even say it in the same sentence. So, if you are allowing yourself to make mistakes, which is really important, then when you notice that things go wrong, you don't have to think, I've I've just made a mistake, but I can't let them know that I've just made a mistake because then they'll know that I'm weak and vulnerable. No, these are your children. They know what you're like, and also, um, being weak and vulnerable isn't a bad thing.
Absolutely,
uh,
yeah.
so when you're saying, if you're like, you've just made me annoyed, you could say, actually, I've just heard what I've said. I'm annoyed, and it might be to do with something you've said, but it's probably to do with the fact that I just don't get why you're shouting at me right now. So just catching yourself and changing it, I think is really important. It shows wisdom, actually, more than anything. It shows that you are self-disciplined, and it teaches your child a really important skill, that they can reflect in the moment.
Absolutely, yeah, yeah, and it's also okay to apologize or to rephrase something that is unhelpful. It's good for them to accept that they can do it in their communications.
Yeah,
Mm.
absolutely. Yeah.
Um, so let's say that as a parent, I have identified some of these unhelpful patterns.
Yeah.
What are some of the barriers that make it really, really hard for parents to break these patterns, even if they are quite aware of them?
Yeah, maybe there's a couple of points here that I could make. There's probably loads of tips and tricks out there that are for, if you've got someone who won't come off their phone um, before bed. I'm sure you can Google those things and you can find those specific tips and tricks. So I guess I'm going to think more generally about how to update parenting so it becomes a bit more compassionate. So more general, I'd say the first general point to break unhelpful patterns is, as a parent, to hold hope for your child.
Hmm.
Some people have spoken to me, and they've already decided that their child is an angry child, a miserable child, a child who won't do anything right. These are labels that we've already put on our child, and you have to remember our child is evolving. They're learning feelings so fast. That brain is trying to get communication right and failing so often.
Mm,
And so, if, for example, your child is in a fight and hurts someone, it doesn't mean that they're a bad person. That's another unhelpful label. And it doesn't mean that you've brought them up wrong.
mm,
That's another unhelpful label that sometimes we put on ourselves. So when something goes wrong, always keep in mind that this is not a fixed pattern of behavior. This is something that's changeable. Behavior is changeable throughout the whole of our lives. It's much
Mm,
easier to change in childhood and teenage years, but can be updated at any time. So if you've got a child who perhaps actually has seriously hurt someone and hasn't shown much remorse, and you've seen that a few times over, absolutely learn some specific tips that you can find online. There are absolutely loads, but just remember to hold hope in mind. You know,
mhm,
that child, if they're upsetting everyone, the chances are they don't have many people who are holding hope for them. Uh,
mhm,
your job as parent is to say, you know what, I can see the best side of my child, and I think right now they're making some bad decisions, but actually I think they're an okay person. Um,
mhm,
the second bit is, um, again, a general theme is when you are stressed as a parent, um, you are less likely to be able to um, notice when your child is doing well.
mhm.
You tend to notice when things are going wrong around you. Uh, it's a bit like we were talking about earlier, Adili,
Absolutely.
when you've got the stress glasses on, you see stress in everyone else. When you are feeling annoyed, the chances are everything your child will do will be annoying. Um, and when you are feeling bad, like a bad person, a bad parent, you will be wearing glasses that will be thinking, ah, yes, see, there's another example of my child being naughty or bad. What it does is it changes the way you treat your child, and actually, you become less compassionate towards yourself, but also less compassionate towards your child. It does then mean that you stop thinking about how to change your child's behavior, trying to communicate more clearly to your child, and patterns start establishing. I guess you could call it,
Mm,
you become a bit of a lazy parent, but I'm not sure that's helpful because it would make sense, if you've seen the same behaviors over and over and you just think, oh my word, can I be bothered? Actually, you've got to hold hope, and you've got to think, look, am I just stressed? Am I tired? Am
mm.
I feeling bad about myself? And is that stopping me holding on to hope about my child and changing my child's behavior?
So the same biases in thinking can affect how we view ourselves as parents, but also how we view our children.
Mm, yeah, we tend to see. Sorry, Dilly. We tend to see that the same patterns that maybe even before you're even a parent, the same patterns, the same kind of negative automatic thoughts that you've been labeling yourself with, tend to start flowing into parenting, and you tend to see those same problems in your child. Or when you label yourself as that, they will affect how you treat your child. So keeping
So,
those things in mind are so important. Having that time to reflect on what's affecting you and the labels you put on yourself is really important.
sure. So you mentioned a couple of examples of compassionate parenting.
Mm.
So holding hope and being kinder to
Yeah.
ourselves and our children. Um, how would you summarize, or how would you define maybe compassionate parenting?
Well, I like to think of compassion, and not everyone has this role model. So it's not always easy. But if you think back into your childhood,
Hmm.
um, you might have like a parental figure, um, who, no matter what you did, they would always have something lovely to say. So you'd trip over, and instead of saying, "Oh, why did you do that?" which would be a critical figure, you had someone who said, "Gosh, he's always been like that. Isn't he lovely? Isn't he kind? Isn't he caring?" That kind of constant positive message,
Hmm.
but that isn't unrealistic. So a message that might be like, "Well, you tried so hard today. Next time, it might go even better." So
Sure.
it's not necessarily saying you're the best person ever and you're amazing, you're incredible. In fact, actually, I think there's been a type of psychology for a long time that said if you tell yourself loads of positive messages non-stop, you will start to feel more positive. But I think what they missed there is if you exaggerate to a point that it's not realistic, then you stop believing even
These
those
statements.
messages.
Yeah, yeah,
Yeah.
absolutely.
So they're realistic statements, but they're just warm, kind,
Mm,
caring, understanding,
yeah,
compassionate,
more hopeful.
holding so much hope for your future. Almost like if you could describe what a smile would say, you know, yeah, you're
That's a good
really
analogy.
good.
Yeah, absolutely.
So the people who perhaps haven't had that influence, perhaps parents who are trying to do their best, but they haven't had a parental influence or maybe a close a person to them who was that kind, compassionate figure. Sometimes we create that figure to keep in mind. Some people think of an angel type figure. Some people in their head they write a list of all the lovely qualities of different people that they've known and they
Mm,
build that into a person. That is your kind of compassionate um, voice.
okay.
and,
So even if
and
we never had that in our lives, we can
mm,
still work on this. We can still develop this image and this voice.
yeah,
Okay.
absolutely. It's a bit like a muscle maybe, uh, and I know we talk about developing strengths in different areas of our lives.
Mm,
Um, Certainly, like you would go to a gym and you develop certain parts of your body that you want to emphasize. This is a part of the mind that you really need to develop if you've not had that influence. And even if you
mm,
have had that influence, it's very easy when you're stressed to ignore it. Um, it might have been that your mum was the most compassionate person. You can hear her voice um, whenever things are going well, which is lovely. But if you can't hear that compassionate voice when things aren't going well or your child's screaming at you, um,
mm,
then that muscle needs to be trained. And
mm.
and I think it's really important. This compassionate voice will help you feel better. You feel better. This is not about parenting always. This is about when you're on your own and the voices are talking to you, because actually we all have these kind of inner voices, these inner dialogue going on. I don't know about
Definitely.
I don't know about you, Adili, but I sometimes go over past events. I usually pick out the ones that didn't go that well. I don't normally go over the ones that go well. And when I'm going through those, I tend to be reminding myself of the things that went wrong about that event.
Mm,
Whereas actually, uh, we need to have we need to allow for that voice because that's probably the side of our brain that's telling us how we can get better. But we also need to have the other side that says, "I think you did your best. You're probably stressed," or
absolutely.
you
Yeah.
know, you know, well, I'm sure if someone else was in that situation, they probably would have done the same thing. Yeah, those kind of messages.
Yeah, that's so interesting. And I'm reflecting back on sessions I had with people, and I can bring into mind people who say, I'm not that pink and fluffy as a person. I'm not, kind in the way that you describe it.
Mm.
Um, what would you say to these people who have already labeled themselves and they are not paying attention, they're not growing? And nurturing that side of them that is more kind, that is more caring.
Mm. Well, it's hard. They're probably doing their best. And at the same time, there's probably more that they could do to build that. And we need to hold that, what's called a dialectic, the two things that seem like they don't come together, but we have to hold
Yeah,
them both. Uh, I also, a compassionate way of perhaps seeing that person who's maybe saying, I'm not a pink and fluffy person, or I'm not a warm and cuddly person. Maybe that's a message that you've been told in your childhood. Maybe one time you were down the road and you were having a bit of a kind of scream, you were being a bit temperamental as a child, and your parent or the person you were with or someone in your school said, "Oh gosh, that person is not a warm and cuddly person at all.
Mm,
They are a really angry, aggressive. Gosh, they're not going to be nice when they're older." Um, those kind of messages tend to stick. We don't tend to remember the events, but we do tend to remember the messages almost as facts. Actually, oh, I'm not like that. Tends to be something that someone said to us usually. So this reminds us about the power of parenting. You can plant these seeds in your child, and you can do it totally accidentally if you're not remembering to be compassionate towards yourself.
mm, absolutely, that's really helpful. That's a really good point because, as you said, one quality doesn't necessarily contradict another quality. The two can go together. We can be very organized and plan ahead, but also be kind and more flexible when we choose to. It doesn't mean that one doesn't go with the other, because a lot of parents, I think, have the fear that if they develop their compassionate side, they might be less strict with the children and they might not achieve the same outcomes as parents. So they might, let go of a lot of the rules, which doesn't really apply, does it? I think that's a myth that if you are compassionate, you're not still communicating the right messages, and you can choose to be strict in areas that are important to you.
You're absolutely right to think about myths that we've believed as facts. And you named a really nice one there. I'm going to say it in a slightly different way, but it's essentially what you said, that uh, if I'm kind and caring, then my child will become a pushover. Or if I show my child too much love, they might be a bit of a wuss. Or you could even go one step further and say, if I'm too kind and loving to my child, they might turn out gay. And actually, these really extreme statements, I use the last one on purpose because actually these are things that people have said to me. They might
Okay.
actually be beliefs that people have held. And you really need to step back and think, where have I picked that up? You know, where,
Absolutely. How is that valid? Who came up with that rule?
who came up with these rules? It's when I hear that, I sometimes think, that's really interesting. Do we have to just pause now and just reflect on that? And
Yeah.
and sometimes people are like, I don't even know where I got that from. And then I think to myself, yes, and you still live your whole life by those
By
rules.
those rules. Yeah, absolutely.
So there's a bit of a strange one there. Um, and I thinking about sexuality, I think it's a really important thing here. I think there's a lot of parents who are still holding on to views um, that are saying that a child's sexuality is defined by how they've parented,
Mm,
and I think we really don't know, but I think it's really important to remember that however your child turns out, your child will be fantastic and wonderful, no matter how you've parented it, as long as you're holding that compassion and that kindness and that love, and you're their champion. I think that's
mm,
the main thing that you need to remind yourself of.
absolutely. Yeah, absolutely. That's a great message. So, what can parents do to act in a more compassionate way? What are some of the maybe behaviors that they can have more of, or maybe thinking styles that would be more helpful? I guess one of them being
Mm.
holding the hope and looking at
Mm.
their children in a more from a more positive angle,
Yeah,
to avoid labeling them in a negative way.
yeah, absolutely. So, I mean, there's lots of tips and tricks out there to um, to be more compassionate. And I think for me, the main one that's worked for me, and it's really important that I remind everyone that actually I'm not perfect at all. Um, I certainly get things wrong most days,
Mhm.
if not most hours. And the main way of developing compassion is to recognize what those thoughts are that you tell yourself and checking them against the facts. What has actually happened right now? Is this the end of the world, or is this just a little blip in the day? Um, there's a whole list online of, and I'm sure in your therapy you talk about different cognitive biases. You might call them something different, but if you search cognitive bias online, they'll give you examples. Uh, and a classic example is catastrophizing, where a child might do one thing. It's similar to what we've talked about. They might do one thing like tell you to F off, and then you think, oh my word, my child's going to be such a horrible person.
Mm.
Where you blow things out of proportion. If you notice that you do that often, you need to maybe start thinking about, how do I change that type of thought? It's possibly affecting not just your parenting, but the whole of your life, the way you see the world. So maybe thinking about that. Um, the other thing is thinking about what your values are as a parent, and how close you are to achieving those values.
Yeah.
So I might write out a number of categories, if you can imagine this. So I might put one category as family, and I draw a square around that. Relationships and intimacy, physical well-being, work, career, spirituality,
Mm.
friends, social relationships, fun, recreation, all different categories. And I think to myself, okay, out of 10 for each one, how
Mm.
important is this to me? And I might say, okay, so family and relationships, that's maybe like an 8 or a 9. And then
Mhm.
the next question would be, okay, how satisfied am I right now with how it is? And I might put a 4 out of 10. And that gives me a really clear way of looking at, okay, what steps can I take? Small steps that
Mm.
might move me this year up to a 10. Now, a non-compassionate approach would be to say, once you've done this activity, right, I need to sort out my life in the next month or in the next day, or I need to sort all of these out right now. Actually, a compassionate person would say, well, you could, but maybe let's pick one or two, and let's focus on them for the next couple of months, see how we do. If it doesn't go too well, maybe bring someone else in and find out from them. Wonder why this isn't going that well. So it's a very gradual, slow process, but it brings you towards achieving a sense of being in line with your values.
Absolutely, yeah. So there is a big trap there, again, for us to be quite judgmental towards ourselves and saying, I should have already sorted this out. I should have already been very successful in this life area. And these criticisms don't really help. So we spend our time and energy thinking about what we should have done, and this energy could have been invested into the future and how we can improve the situation as a next step.
Mm, absolutely.
Great, that's really helpful. So it's really important for us to have this balance between life areas, so not just to think about our parenting and our role as parents, but also feel that we're active in other life areas that are important to us, isn't it? So that we can
Yeah.
recharge our batteries and we can come back to parenting feeling refreshed, having more energy to invest, isn't it? And work on these difficult patterns that we've mentioned.
Y- You're absolutely right there. My go-to is going for a run, and
Okay.
I find that it clears my mind. I actually do a lot of my, where I was talking about those dialogues, those negative voice and the compassionate voice, and how it kind of jostles. I do a lot of thinking when I'm running, and
Mm.
if I didn't go for a run or didn't give myself that time, I wouldn't really be able to know what's going on. Sometimes your head's so full of stuff, it's actually quite hard to work out, why was I angry with that person? And if you've
Mm.
not got time to think about that, you're going to carry on being angry, even if you don't
Sure.
want to.
Sure, absolutely. So it sounds like the whole situation with the COVID-19 and the quarantine
Yeah.
might be reinforcing that difficult pattern. So we might feel that our heads are fuller with information, with anxiety, with fear, with uncertainty. And do you think that this has an impact on relationships with teenagers and our communication with them?
Yeah, absolutely. You know, I think worry, it's really important to say, is a very natural process, and it was originally designed to keep us safe from danger. And often, one of the main messages that children are trying to communicate to us when they're angry or sad or upset, or the kind of the obvious stuff, underneath it is generally worry about danger. And that's because the brain is working about out what is safe for me and what isn't safe in this world. We learn as a child from our parents that generally the world is a pretty safe place, and we go into adulthood with that kind of strong confidence that things are going to be okay. We are not prepared, and it doesn't matter what kind of parenting you get. If you've never been through a situation like this, including me, I've never been through a situation like this, it means that we are um, not prepared. Our brain hasn't wired itself to be ready for this. And so the learning process begins again. And if you think about when your children are responding in a very weird way, because essentially their brain is forming wires to make sense of the world, we start responding in kind of weird ways too, because the brain has to start adapting to this new way of living, this new normal.
Mm.
Um, I think the main challenge with um, a situation like we're in now is that uh, there's the hypothetical worry, which normally we would say was more a generalized anxiety, like I wonder what will happen in the future. Now, usually we would say, well, is it important to think about that, or does that really matter? In this kind of hypothetical, in this kind of hypothetical thought, actually, it relates to our own safety. What will
Mm.
happen in the future? So these worries are totally normal. If you're worried, your child will be worried, and together you'll be worried together, and it'll probably make it a little worse.
Mm.
Um, we also know that worries lead to people becoming more tense, getting muscle tension or aches and pains, feeling restless, unable to relax, difficulty concentrating. All the time that we've been talking on this video, we've been talking about stopping, pausing, reflecting. Actually, the compassionate voice right now would say, and let me be that compassionate voice for you. Whoa, whoa, whoa. When you're trying to stop and your head feels full, that's probably because it is full, because we're going through a crazy time right now. You're
Mm.
not going to be able to concentrate very easily in the moment. Let yourself off for being a bit annoyed. At the moment, you might struggle to press pause. And I think that's something that we are just going to have to accept in this
Mm.
kind of new world.
Sure. And it sounds like you mentioned physical symptoms of worry and anxiety, and that makes me think that maybe it would be helpful for us to be sensitive towards our children's physical symptoms. And if there is a
Mm,
new symptom that they're reporting, if there's something new that's bothering them, it's
yeah.
worth thinking, is it a sign of, physical health problem, or is it mental health related? Is it linked to difficult thoughts and difficult feelings? That's a really good
Mm,
point.
mm. Yeah, your child will be looking to you for reassurance and care. And if they can't
Mm.
find that, we tend to find that the worries build up inside them. And a bit like a
Mm.
Coke bottle that's been shook, y- y- is only so long before that will explode
Explodes.
in some way.
Yeah.
And sometimes it can be through anger, which is more obvious, but sometimes that explosion can be through, like you said, aches, pains, chronic pain sometimes.
Mm,
Um, that's one of those things that's really difficult for us to make sense of. Um, but usually those when stress reduces, we also see those symptoms reduce too. Whereas if it was a physical health problem, usually when stress reduces, you might see it reduce a bit, but it wouldn't go away totally.
mm, sure.
So it might be that as you can listen to your children, talk with your children, tell them how you're feeling without putting your feelings onto them. So saying, sometimes I feel worried, but right now, if you've got any worries, you come to me. You could say to your
Mm,
children. And if you're able to take away their burden and they're still feeling quite unwell, it's really important you pay attention to those physical symptoms. You can always get those things checked out. And if it comes back that actually it might be stress or it might be the environment that we're in right now, it might be related to how they're feeling,
mm,
um, then that's okay. You checked it out and you did what you thought was best. And that's a compassionate thing to do, to say, well, I took them to the GP. The GP said that everything's okay, but that's okay because I was doing my best as a parent.
absolutely. Absolutely. So I guess the takeaway message for me is that we can really work on our behaviors and our communication if we don't first pay attention to our thoughts and feelings, if we're not able to reflect on how we feel, if we're not able to catch unhelpful thoughts and work with them. It sounds like it's unlikely for us to communicate effectively. It's a whole cycle, isn't it, of reflecting on our thoughts and feelings and then choosing the most helpful behavior.
Absolutely. I'm reminded to what you were saying. Feelings aren't facts, myths aren't facts. We need to check out those thoughts and just
Mm,
think, are they helpful right now? Are they leading me towards being a compassionate parent? Or actually, are they making me a little bit too punitive right now when
mm,
actually my child just needs space to stop?
sure. Thank you so much, Johnny, for your time today and for your incredible tips. You gave us a lot of food for thought to think about our relationships with our children, but also other members of the family. So, thank you. That was great. I found that really helpful.
Well, thanks for the invite. It's a real pleasure.
See you later. Bye.